Well, hi everyone. Welcome to our webinar this evening. My name is Katie and I'll be your host, and I will introduce our speaker here in just a minute. We have a really great presentation for you tonight. So let's just jump right in. The topic is say no to diabetes complications, say yes to reducing your risk, keeping your kidneys, nerves, and eyes healthy. So welcome to our webinar. Should you have any technical difficulties, there is a phone number here at the bottom of your screen. Let's see. Thanks, Emily. The number is 1-800-263-6317. All right, our format includes a short presentation followed by an interactive discussion. To type in a question, use the question section of the webinar toolbar. Your toolbar should be probably to the right of your screen. You can drag it around and move it, so you can see your slides a little bit better. But if you're joining tonight via GoToWebinar, that is how you will ask a question. If you're just calling in and listening, of course, you won't have that toolbar, and unfortunately, you wouldn't be able to ask questions either. But to those of you who have just called in to listen, we're happy you're here as well. So at the end, we'll have a chance to ask questions, and so we look forward to an interactive webinar. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, but please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Care and Education Specialist will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. Our speaker this evening is Emily Stott. Emily graduated from Illinois State University with a Bachelor of Family and Consumer Sciences. And then she also graduated from Eastern Illinois University with a Master's in Dietetics. She's previously worked as an outpatient registered dietitian and certified diabetes care and education specialist at 2 different outpatient clinics. Emily has been educating patients about diabetes, cardiovascular health, and weight loss for the past 10 years. She lives in East Tennessee and enjoys hiking with her family. So, Emily, thank you so much for joining us this evening, and you may take it away.
Wonderful. Thank you, Katie. Hello, everyone. Thank you for joining us here tonight. Like Katie said, we're going to just be talking a lot about what are potential complications of diabetes. In particular, like this first bulletin says, what does it mean by microvascular complications? This might be something that you have talked about with your doctor. This may be something that you've read about online. This might be a brand new topic for you tonight. So we're just excited for you to be here, and we will also throughout tonight we'll be talking about what you should be talking to your doctor about. Also, if you are participating in our diabetes coaching phone calls as well, these are things that you should be talking about with your coach as well. So, and like Katie said, here at the very end, we'll be going through a lot of questions as well. So tonight, I'll be just talking about what are the microvascular complications, how can these problems be prevented, and then questions, answers, and sharing as well here at the end, but also throughout the presentation as well. And like Katie said as well, please do talk with your healthcare provider before making any changes to your diabetes treatment plan. And we all know that each person is so individual, especially whenever it comes to their diabetes, their blood sugar numbers. So definitely talking to your doctor is the best thing to be doing with any of these topics tonight. All right, and then let's see here. All right, so first of all, what are microvascular complications? Very specifically, these are damage to the small blood vessels in our bodies. And this can be caused by either too much sugar in the bloodstream, such as diabetes. So think of having a higher A1C, or can also be related to too much pressure inside of the blood vessel, which would be a fancy way of saying high blood pressure. So if you have diabetes and or high blood pressure, well, that's why you are here tonight. And this is why we are wanting to talk about it, because we want you to start those conversations with your doctors as well. So it is the damage to the small blood vessels in our bodies with that. All right. And then what parts of the body are affected? And you'll see here it's for any parts of the bodies that have very small or delicate blood vessels that can be easily damaged. And so some of the main ones that we will be focusing on tonight are your eyes, your nerves, particularly in your feet as well, and then also your kidneys as well. So these are some of the main groups as well. But you'll see here throughout that there might be symptoms that you also want to talk to your doctor about at other points of your body as well with that. But the diabetic eye disease, this is whenever high blood sugars can cause problems in your eyes, such as blurry vision, cloudy vision, increase in eye pressure, a loss of vision. Sometimes even whenever someone is having really high blood sugars, they might be saying, my eyesight has changed, or things are a little bit blurry now, or what have you. If you are experiencing any of these symptoms and especially having high blood sugars, that's also a great thing to be talking to your doctor about for guidance as to what they would recommend for you with that. Now, how do you prevent eye problems? First of all, making sure to see your eye doctor once a year, at least once a year, for a dilated eye exam. This is something that the American Diabetes Association recommends to have done at least once a year, and that's really just so that the eye doctor can just make sure everything is a-okay there. And so that's the first thing for prevention. But also, we want to keep in mind that just because you do not have any changes in your vision, it does not mean that you do not have any changes to the blood vessels. And that's really important as well, because like I said, diabetes is so different for each individual. And so we can't just go off of, are your blood sugars high? If so, then you must be having eye problems. That's not always the case. So seeing that eye doctor and seeing how things are going. Also, vision may not be affected until later in the progression of the eye disease as well. So everyone is different. The progression is different for each person as well. So just having that eye exam can really benefit you as the individual as well. So what are some things that we can do to prevent the eye problems? First of all, uh, keeping blood sugars and also blood pressure under control are two things. So again, both of those main topics, you go back to your doctor, right? You start saying, I'm seeing these higher blood sugar readings. What is my next step here, or what are some things that might need to be changed? And so those are your two main things to be really focusing on there. And let's just say maybe your doctor has never mentioned having an eye exam before. Well, tonight is your reminder that at your next appointment to talk to your doctor about it, or else always reaching out to Health First as well would be an option, or your health insurance with that, just to see about what coverage would be as well for you. So up next, we have the diabetic nerve disease. And this is whenever high blood sugars can damage the nerves, causing pain, burning, tingling, loss of sensation. And you'll see here, hands, legs, and feet are most affected with that. So that's why on that very first screen, whenever it was showing the different parts of your body, it's not just the feet that are affected by the nerve pain. It can also commonly be in the hands or the legs as well with that. And this is a very common complication in the diabetes. If you kind of think of it, kind of like the blood sugars, they just start to coat around your nerves with that, which can deteriorate the feeling that you're feeling. So you might not notice things as easily as what you used to with that. Also, that tingling, burning sensation is something that I've heard a lot of people report. And just like I said, it's pins and needles, very uncomfortable with that. And sometimes people only notice some of these early signs whenever they're having higher blood sugars or a spike in their blood sugars with that. And so Damage to the small blood vessels reduces the blood flow, and that can also lead to other issues as well with that. So that can include sores that won't heal, dry or cracked skin, swollen or bluish feet, legs or feet that hurt during exercise, or even legs that hurt or feel restless at night. So I would just encourage each one of you just to be thinking about what are something, is any of this ringing a bell to you? If so, these are other things to be talking to your doctor about in relation to the diabetes and high blood pressure as well with that. And you'll see right here, it says a dangerous combination. Damaged nerves plus poor circulation is a dangerous combination. And part of that is because the nerve damage may cause a person to lose feeling in their feet and then not be able to feel the pain, the pressure, the heat, or the cold with that. So in relation to some of those other symptoms that we had talked about, maybe they have a sore or a blister and not be able to feel that sore or blister, right? Whenever you have uh, think of just wearing shoes and you're trying to go for a walk and you get a blister. Well, for most of us, you can't stop thinking about that blister, right, during that entire walk. But if you don't have as much sensation there, you might not notice that blister or sore. And then that sore could become infected. And then poor blood flow makes it hard for the body to send all the cells that it needs to help fight off the infection. And then that infection, very in some extreme situations, can even lead to an amputation with that. And so that's kind of the process that can happen with it, where, and if you remember, we just started with a sore or a blister, right? And then it does escalate with that. So that's why all these steps, it matters, right? It matters about, are you checking your blood sugars? Are you talking to your doctor? Are you checking your blood pressure? Are you taking your medicine? All these different things, they add up with it. We talk a lot about what those daily healthy habits look like, and this is part of why we do address those during our phone calls with it as well. And so how do we prevent these problems? First of all, check your feet daily. This is really important, just it takes about 10 seconds, if that, just making sure everything looks good. Like I said, we're going to focus here with the feet because especially with the nerve damage, this is where a lot of people feel it first with that. And then every time you visit your health clinic, make sure you take off your shoes and socks to have your feet checked. And at least once a year, a foot exam in which the doctor uses a tool to check your sensation and blood circulation to your feet with that. So what this is saying is either whenever you see your endo or your PCP, or maybe you see a podiatrist, someone should be looking at your feet at least once a year. That's another recommendation for the American Diabetes Association. And they do this exam called a monofilament exam. That's the foot exam that they're talking about. And you'll see right here in the picture, they're just barely touching the end of this person's foot here. It's kind of like a fishing line with that is kind of how it feels. And it's really just the patient has their eyes shut and the doctor's going to be touching different spots. And the patient is either going to say, yes, I feel that, or this is where that is, or whatnot. And I have been there with different appointments with patients that are having these foot exams done, and sometimes the patients do not feel what the doctor is touching at the bottom of their feet, and so then that leads into more conversations with that. So this is a once a year a once a year foot exam, at least with that. So if you've never had this foot exam done, please do talk to your doctor about that here at the next time that you go in to see them. And like I said, either your doctor can do it. Sometimes they might have you go see a podiatrist. It just varies person to person, but talking to your doctor is the main thing there. And then also, how do we take care of our feet day to day? Like we said, making sure to check your feet every day. We're looking for cracks, blisters, cuts, or dry skin. Be sure to even look between the toes and at the bottom of your feet as well. Some people might have to use a mirror or have someone help you with that. And if you are noticing something, please do reach out to your doctor with that, because as we saw a couple slides ago, one little sore or one little blister it can lead to bigger issues. So if you're noticing something, we want it taken care of as soon as possible with that. And so we also want to, with taking care of our feet, we're also wanting to really make sure we're washing our feet good every day, making sure we're drying them well as well. And also, if you're having some decreased sensation in your feet, you might not notice if it's hot or cold. So even checking the temperature of the water with your wrist or your elbow first to make sure it's not too hot is a good option too. And finally, do not soak your feet because this can cause the dry skin as well. So these are just a few things, but really, you know, either your doctor or the podiatrist will even go into more details with what does the daily care of your feet look like with that. And so using lotion can also help, but we want to try to stay away from any lotions that have any type of perfume or alcohol with it. Just a very generic type of lotion is great for your feet. And again, we're just wanting to take care of your feet, which for a lot of us is probably something we don't think about day to day with that. But we do want to be mindful of these steps and to be looking at, am I doing this? Am I taking care of my feet? If not, these are some things that you can definitely be starting today as well with that. Also, making sure to trim your toenails straight across um, with that, with a nail file, and also, like we said too, see your doctor for care of any other corns, calluses, warts, anything else that you're noticing on your feet that you're not quite for sure on how to treat it or what you're supposed to do. Please go back to your doctor because we just don't want to have any other type of infections to occur as well with that. And so we also, with foot care, it's not just like how we are maintaining our feet, but it's also what we are wearing with our feet that is so important too. So making sure to wear comfortable shoes that are fully covered and protect your feet. We want to also get into the habit of shaking out your shoes and socks before you put them on, just to make sure that there's no rocks or anything inside of it, right? If you're having decreased sensation in your feet, you're not going to notice if there's a rock or a pebble inside of your shoe with that, and that can lead to a sore as well. And also, and your doctor will, I'm sure, will talk more about this as well, but we want to be careful about going barefoot as well with that. Again, we want to just protect our feet with that, especially if they've had any type of nerve damage to them as well. So, what are some things that we can do to help prevent the foot problems? Um, Number one would be to keep the blood sugars under control, right? With that, like I said, I've had people tell me whenever their blood sugars are up higher, they notice either a tingling feeling in their feet, or else maybe you've been noticing over time that you just don't feel the bottom of your feet just don't feel the same anymore with that. So these are some things to be doing with it. Also, helping with quit smoking as well. Whenever you are smoking, that can really affect the blood flow throughout the body as well with that. So, and a lot of this as to why it goes to the feet, not only the nerves, but it's also the blood flow. And with your feet being so far away from your heart, it takes a little bit more to get the blood flowing to your feet as well. So smoking can really affect this as well. And then the third thing I would also recommend with preventing any type of foot problems would be to see your doctor and to start this conversation if you haven't already. I have worked with several people here over the years who have said that they've never had a foot exam or the doctor has never mentioned that. And and I believe it because I know during a doctor's appointment there can be a lot of information to cover, right? Or that maybe you're starting a new medication and that might take up most of the doctor's appointments. So, but these are still things that are important as well. So we want you to, jot that down, talk to your doctor the next time with that as well. All right, so the next item we're going to talk about tonight is the diabetic kidney disease. So we've already been working through these microvascular complications with that. We've talked about the eyes and the feet and the nerves, right? And then the next bigger one is the diabetic kidney disease. And this is, as you may know, kidneys help clean the blood and filter out the waste that can make us sick if it stays in the body But high blood sugar and high blood pressure can cause damage to the small blood vessels in the kidneys. And people with kidney disease may not have any symptoms at first with that. As kidney disease progresses, waste that is not being removed from the blood can cause a person to feel sick with that. And then at the very end, after someone has had chronic kidney disease, and like it says, it does progress, and if you get to the highest stage of kidney disease, you may have to start something called dialysis. And this is whenever a machine is used to help filter out the waste from the blood if the kidneys are no longer able to do this. And so sometimes with kidney disease, the doctor might have said that maybe you have some type of kidney disease. Maybe it's not to the dialysis, but they might have said, we're just going to keep monitoring your kidneys, right? Or else they might say, we're going to do a test today to look at your kidneys. This is what they're talking about, is because whenever a person has diabetes, high blood pressure, the kidneys are something that they are also really taking a close look at to make sure everything is okay. So you can think of your kidneys kind of like a colander that we use to drain water after pasta. It works by filtering out the waste, which would be the water, but keeping what the body needs, which would be the pasta inside of the bloodstream. But whenever the kidneys start to get damaged, it's like the colander gets leaky. But instead of pasta, what the kidneys lets through is protein, and protein is a large molecule and our body needs it, so normally it does not go out into the urine. And whenever protein starts to show up in our urine, that tells us that the colander is getting leaky and kidney damage has started to occur. So we know that from this example, whenever you're doing a urine test at your doctor's office, and one that's very common is this microalbumin test, where they are looking to see, is there protein in the urine with that? And this slide kind of explains a little bit of what it is, where if they are seeing some type of protein in the urine, that is an indicator that the kidneys might be damaged or that some damage is starting to occur with that. And so how do we prevent kidney disease? First is having that urine protein test every year. So this is something else. If you don't think a doctor has ever talked to you about this, or you've never had to complete one, please do bring this up at the next time with that, and ask, have I been doing this test? And if so, what are my numbers showing me? Also, making sure to drink plenty of water, um, and quit smoking is something else that can really affect as well with this. Really, the quit smoking really helps out all of the microvascular complications as well. Taking all your medications as directed, stay active and eat healthy, which if you have a lot of questions in relation to more of what does that look like for staying active, eating healthy, we have had other webinars that focus on that. Those are also great questions to talk to your doctor about, or if you are still doing your coaching calls, ask your coach about what does that mean for you as well. But then also, most importantly, how do you prevent kidney problems? First would be making sure to keep your blood sugars and your blood pressure under control. Um, it's easier said than done, but what can happen is, as we can see, is that if your blood sugars and blood pressure are remaining up too high, well, then that's just a lot for your microvascular um, parts of your body, and then that is what is leading to those other complications with it. But then also, how do we prevent this as well, is making sure that you and your doctor are having this conversation about, have you had that urine test to check for protein in your urine? And then for you just to continue to be focusing on your day-to-day activities and continue to be monitoring makes a big difference as well with that. All right. All right. So here we have some time, like Katie said, we have some time to really focus on questions that you all might have for us as well with that. And as you may be thinking about what are some other questions that you have, I did jot down a couple questions that other patients have asked me before in relation to the microvascular. And one thing that comes up a lot is what to do if your doctor hasn't mentioned any of these extra exams or has not ever said anything to you. Maybe you're just told everything's looking good, continue on. Well, even if that's the case, we still want you to talk to your doctor. Even if your A1C is at goal and blood sugars are looking great with that, we still want you to talk to your doctor and say, do I still need to get my eyes checked with that? And for you to have that conversation with that. As you see, a lot of what we covered is more preventative type of care because we do believe that more education that you have and staying up to date with that, with all your tests, it is going to help you in the long run as well. And we also know we don't want to just wait for problems to start showing up, right? We want to try to be proactive as well with that. And and another question that I get asked is, what can I be doing to stop the progression of the microvascular diseases? So you saw here several times throughout our presentation, it was a lot about making sure to control the blood sugars, control the blood pressure, quit smoking, right? Those were three common threads throughout it. And so we know that those take a lot of work with it. And it does come down to, okay, are you taking your medicine? If you're able to exercise, what does that look like? And are you committed to that? Especially here with it starting to be prettier outside. Hopefully, we all can start adding that more into our regimen a little bit easier with that. But also, our diet plays a role with it. Any type of lifestyle choice plays a role with how we're doing with everything. But also, I think monitoring your blood sugars, monitoring your blood pressure, if your doctor wants you to do that as well, is so important because then that way you'll know before you even go into that appointment, what are your numbers looking like with that. So that definitely plays a role with that as well. So, and one other thing that I have had other patients kind of talk to me about is what do you do where, well, maybe I should state it more as they might have, say, a patient comes to me with diabetes and maybe they're scared because they have another family member who's on dialysis, or they have a friend who had to have a toe amputated, or like I said, these are more of the extreme situations, but they do happen with that. And so they come into the meeting with me and they might be a little scared, right? And a little bit of, I don't know what to do next with that. And so, as a diabetes coach, my job is really just to kind of walk right alongside that patient and really say, okay, so it sounds to me like you're nervous about this. What are some things that you can be doing to really focus on that one particular goal right now? And I think that that's something to be focused on there with that as well. So, okay, and I have, all right. Okay, and so I have a question right here. What is the difference between microalbumin and then also the urea test with that? And so the microalbumin would be checking more of the protein in your urine with that, and the you, if you have your labs right there, which I'm sure you all didn't bring your labs with you today with that, but you'll see on your labs for the microalbumin, it will say as to what is the amount of protein in your urine with that. But the urea test with that is looking at the blood urea nitrogen test, measures the amount of urea nitrogen in your blood, which is another type of a waste product as well with that. And so it's a little bit different as to the how it affects the kidney failure with that, as to what the doctor's looking at. I'm really not quite as well versed with that. Uh, Katie, if you know more than I do with that, you definitely can jump in with that. I will say the protein is what we are really looking for from the kidneys point of view with the diabetes. All right. And then I have another question here. Why no nail clippers? Great question. So with the nail clippers, it's more of if you're already losing some of that sensation around your feet, around your toes, you might not notice if you accidentally snip yourself with the nail clippers. And so by using more of a nail file, that's a little bit smoother way to make sure that you're not, like I said, going to hurt yourself in any way like that as well. So that's the main point with that. Now, if especially I think this is where it's important to be seeing a podiatrist or talking to your doctor about nail care as well. They might tell you, you know what, you're still having a lot of feeling with that, that's okay for you to do. Other people, they would be nervous about that patient accidentally snipping themselves with that. But that's a great question have as well. And I also think with all of with these questions, other things that we've talked about as well, is making sure whenever you get your blood work from the doctor's office, oftentimes the doctor might say, I will call you if anything is alarming, right? Or if anything is considered high, I will call you about it. But I also think it's important to be getting into the habit of saying, can you tell me what these numbers mean for me? Or what is this looking for right here with that as well? So that those, it's all important how it all affects one another as well with that. But are there any other questions tonight? Anything else that I can answer for anyone? Okay. Well, and just as a reminder, too, with that, there is another upcoming live event. I think this is actually supposed to be May 23rd, 2023, with that as well. You can always look on our website as well with that to see what additional classes are coming up with that. But especially our exercise classes, our nutrition classes are always super popular with that. So that's wonderful. But any other questions for tonight? Oh, okay. One just came in here. Okay. Is there natural caffeine in B12 with that? And I will say I am not 100% sure with that. With that, I would direct that question back to your doctor with that, especially as to why you're wanting to take it. What benefits has a doctor talked to you about that? And especially with the caffeine component, is something, keeping you up later at night? Are you just curious? What have you? I'd always go back to your doctor, especially whenever there's anything with supplements as well with that. But great question as well with that. All right, wonderful. All right, is that
It
okay?
looks like there may be one more that just came through,
Okay,
Emily. Oh,
let
it's just a statement. Yeah.
okay.
Could you see it?
Let me scroll down here.
It's about the,
Mm-hmm. Uh, okay, okay. With that, yeah. Oh wait, there is
can you see it?
okay.
It's just
Yeah,
related to the caffeine.
yeah.
Yeah.
I would say back to that. I would have you go back to your doctor. With that, I really couldn't tell you if there is caffeine in it as well with
Mhm.
that, but. All right. Well, thank you all for all your questions and comments and everything. I really do appreciate it. And like I said, please do go back to your doctor and make sure that things are being checked. And if you're unsure about something, please do ask those questions as well. Thank you.